Good day to all. So today we'll be discussing on influenza. Okay. So what is influenza? It's an acute respiratory tract infection caused by the influenza virus, three types, that is A, B and C. All known pandemic is caused by type A strain. So when we discuss on influenza and when I tell you that it's an acute respiratory tract infection and also it causes pandemic, what does it comes to your mind? Right. So currently the pandemic which has been caused, the disease is called as COVID-19. Okay. But what is the name of the virus? COVID is the name of the disease. It's not the virus. And the coronavirus is the name of the family of the virus which it belongs to. Okay, right. So the name of the virus which causes COVID-19 disease is called as SARS-CoV-2. Got that? Okay, just an additional information because it's influenza and it causes pandemic. It also belongs to the same family of viruses. So we'll be parallelly discussing on the current pandemic which is already happening. Okay, right. So the epidemiology of this disease, it's a truly an international disease. As per the when it comes to COVID-19, it's 2, right? Okay. Just a minute. Yeah. For every 10 to 15 years, pandemic occurs due to the antigenic variants. So the COVID is a new thing. It's a mutation of the coronavirus. Okay. And you can see that in 1918 we had Spanish influenza. In 1957 we had Asian influenza. In 1968 we had Hong Kong, and so on. Where recently we have COVID-19, which has been affected. So we can see that in 21 million people died worldwide, mostly due to secondary bacterial pneumonia. And again, when it comes to COVID, the most of the cases, severe cases of COVID is mainly because of the pneumonia, and that's where the most of the elderly population is dying if they're infected with COVID-19. So there is also a cycle which keeps repeating every once in few years. So you can see that there is a 2 to 3 interval influenza type A which causes, and 4 to 7 years interval there is an influenza B which comes across. Now look into unique features of influenza epidemic. So what happens? It comes sudden, right? As COVID-19 spread and ease which they spread is very easy. Short incubation period. Again, COVID-19 is 5 to 10 days. And large number of subclinical cases. We have a lot of subclinical cases yet to be diagnosed. High proportion of susceptible population. Now, when you ask who is susceptible, everyone is susceptible, right? And short duration of immunity. So as of now, once the patient gets a COVID-19 case, the immunity is not yet confirmed, but again, there's a short immunity maybe, but there is also reported cases of reinfection of COVID-19. So we are not sure about that. Again, here also in influenza, it's a short incubation, immunity is given. All contributes to its rapid spread. At present, 3 types of circulating influenza virus, that is H1N1, H2N2. The H1N1 is an A virus, H2N2 is a B virus. Okay. So WHO Global Surveillance identified human infections with a new influenza virus called as H5N1 in Hong Kong in 1957. So now let's look into what is avian influenza. It refers to large group of different influenza viruses that primarily affects birds. Majority don't infect humans. However, avian, that is H5N1, is a strain with pandemic potential since it might ultimately adopt into a strain which is contagious among humans. So in Hong Kong, H5N1 strain infected human causing 18 cases, including 6 deaths. In mid-2003, virus caused largest and most severe outbreak in poultry on record. Since since there were over 100 cases have been laboratory confirmed in 4 Asian countries named Indonesia, Thailand, Cambodia, Vietnam. More than half of the people died, as you can see also in the COVID case in situation, because of we have lockdown and there is social distancing, people are educated, the deaths are decreasing, deaths have been contained, but still in many of the countries, like even in developed countries like USA, you can see the deaths have been increasing every day, right? So as you can see in the graph where you can see the number of deaths and of cases, but in case of COVID-19, the numbers are very big than this what you can see here, right? Okay, so let's see, most cases are occurs in previously healthy children and young adults, but here it occurs more in elderly people, right? And also for young adults also. The virus is spreading rapidly, reaching all continents less than 3 months due to the spread of international airway today, and that's the same situation in terms of COVID-19 too. But death rates are determined by 4 factors. 1, the number of people who became infected, that's correct. The virulence of the infection, highly virulent, more deaths. The underlying characteristics and vulnerability of affected population. So who are the vulnerable population? Normally the elderly and the kids are vulnerable population, but in this case the highly vulnerable population would be elderly population, and also people with comorbid condition like diabetes, hypertension, and any other chronic diseases which they already have would be highly vulnerable for this type of infections. Effectiveness of preventive measures also makes a big factor in controlling this disease. So coming to epidemiological determinants, let's look into the agent factors. I can see again it's a type of coronavirus. What is meant by corona? Why the name virus is called as corona? Because it has a crown type of appearance. So there is what is a crown? Crown, like when a crown, normally there are spokes in the crown. There are bulged patterns. You can see there is the entire circle has a crown. So everything has the spokes which shows crown, right? So it belongs to Orthomyxoviridae, and the teeth of ABC, antigenically distinct, and no cross immunity is seen. So currently classified as H1N1, H2N2, H3N3, and there are old classifications. Let's not go into that. But both A and B virus has 2 different surface antigens, hemoglobin H and neuraminidase N. H antigen initiates the infection, and N antigen release of virus from infected cells. Influenza A virus is unique, subjected to antigen variation. A sudden, complete, or major change in the shift can occur. Antigenic change is gradual over a period of time, which will called as drift. So you can see there is dates and number of. So example started with 1989, where there was H2N8, which is an older name, and now in 1977 till where we have that H1N1 came into existence. Right, so now we have COVID-19, also called as SARS-CoV-2, the virus. Coming to the reservoir of infection, mainly animals and birds. Some include H and N antigen related to humans. New strains by recombination influenza virus between a man and animal bird can be done. So source of infection, usually case or subclinical cases, nasal secretions are infective. During epidemic, large number of mild and asymptomatic occurs, plays an important role in spread of these infections. Coming to the period of infectivity, nasopharynx is where it enters 1 to 2 days before and 1 to 2 days after the onset of symptoms, where it causes infections to others. Coming to host factors, age and sex. All age and both sex are affected. High mortality rate among certain high risk groups. Old people, children under 18 months, diabetes and chronic heart disease are highly vulnerable. Human mobility, important factor is spread of the infection. So we have now restricted the human mobility in terms of COVID-19 case. Coming to immunity, subtype specific. Antibodies against HA and NA. Antibodies appears about 7 days after the attack and reaches maximum level in about 2 weeks after 8 to 12 months. and level drops to preclinical infection level later on. So coming to environmental factors, season, as you know, in winter, northern hemisphere winter or rainy season in southern hemisphere has a higher chance of spreading of the disease, right? Okay, and then we have overcrowding, enhanced transmission, school institutions are where there are more number of cases. So that's where still government is thinking on reopening of schools and the institutions. Mode of transmission, person to person by droplet infections, nuclei created by the sneezing, coughing, talking, the port of entry is viruses, respiratory tract. All these things you all are aware of as of now, because we are in practical situation. We are in the situation of COVID-19, so which gives you a great insight into a pandemic disease, because you are experiencing it. You are experiencing the social distancing. You are experiencing the hand wash, the pleasant hygiene which you are maintaining. So you are experiencing everything, and that's where it becomes very important, right? So incubation period is 18 to 72 hours in this case, and pathogenesis mainly it leads to inflammation and necrosis of superficial epithelium, followed by secondary bacterial invasion, and there is no viremia. Clinical features, as you can see in all the respiratory cases: fever, chills, aches, pain, cough, and generalized weakness. Fever lasts 1 to 5 days. And what are the complications? Pneumonia, Guillain-Barré syndrome, Raynaud syndrome, and fatty livers are some of the complications. Laboratory diagnosis: viral isolation, nasopharyngeal secretion, use secondary baboon kidney cell or kidney non-specific CP certain days, so these are laboratory diagnosis, more of viral isolation you have to do, and this is done in specific laboratories all over India. And these are some tests: hemagglutination, specific identification by direct fluorescence, antibody technique also can be used. Some other things: paired sera, that is essential to examine paired acute convalescent sera to demonstrate a 4-fold of great increase is also can be done. So these are the facilities in South India, that is Mumbai, Kolkata, New Delhi, AIIMS. Then you have Vallabhbhai Patel Chest Institute, Delhi, Pune Armed Force. All these places where you can get the specific viral testing done and diagnosis of these viral cases. Coming to prevention. So when you look into prevention, the sensible precaution is good ventilation of public buildings. So when you're working, right? Avoidance of crowded places during epidemic, encouraging sufferers to cover their faces. Someone stay at the signs of influenza, so people have to stay at home. Okay, right? A number of field trials have been shown vaccination highly effective. Admissions at least 2 weeks before an onset of the epidemic. Influenza vaccine recommended only in selected population. In industry to reduce absenteeism and public, people have to start working, right? So coming to the influenza vaccine, it's a killed vaccine. Mostly vaccination programs, its users grown in allantoic cavity of chick embryo, purified, killed by formalin or beta propion lacto. Okay, 1 day of vaccine contains 15 microgram of HA administration subcutaneously, 0.5 ml adult and children over 3 years. And these are some of the specifications you can think of, nothing much to, and you can see this is for flu, vaccination, subcutaneous infections. Coming to disadvantage. What is disadvantage? Fever, local inflammatory, rarely Guillain-Barré syndrome signs of hypersensitivity will be there. That's important. Live attenuated vaccine based on temperature sensitivity mutation used in USSR. Administration as nose drops. So if you've seen the recent, I think there's a movie which I think most of you have seen because of the pandemic. I forgot I think pandemic, what was the name? I think there was a name movie, right? The pandemic on. So you can see that in there again there was a vaccine which they created at the end of the movie, and how the vaccine, it was given nasal drops. They should press and inhale to get the vaccination, right? Okay, so with that we covered the topic on influenza, right? So if you're looking into looking into know and get more information on COVID-19, which we are currently into, because you have to knowledge as a medical student, you have to be completely equipped with the knowledge, right? And also along with getting the knowledge, if you go to the link which we have given in the below this video, if you click the link, you'll go to a platform where you can access this complete content on COVID-19 training, and you also get a certification once you complete this course. Okay, so I would suggest if you could take this course, it would be great, because you would equip yourself and your family and your neighbors, relatives, to actually fight this COVID-19, because it's still a long way to go, right? Thank you. Let me know if you have any questions in the comments below. Bye. Take care.
Hello all.
Seriously?
Now we'll be looking into QR. Fifth, look for standardization 5, 10, 8. There is an ST elevation. Please go repeat along with me. Look for standardization 5. I'm a strong believer that learning should be fun and interesting. To make this entire training program of ECG in the so what do we require is a compass box.
Come on. ಮಾಡ್ತಾ ಇದ್ದಾರಾ?
ಅವ್ರು ಮಾಡ್ತಾರೆ.
ಓ ದಿಸ್ ಇಸ್ ಸಮಥಿಂಗ್ ಎಲ್ಸ್.